Welcome back to Roadmap to Residency. Today we are attacking stroke and transient ischemic attack on Step 3. We are not reteaching the Neurology chapter. You have review books for that. We are showing you how the test writers build these stems, which single detail decides the answer, and how to spot the traps. 4 full question walkthroughs, every choice explained. Let us begin. Here is the plan. Acute Stroke Management, where the question turns on a clock and a scan. Transient ischemic attack, where the symptoms resolved and that is the trap. Antiplatelet versus anticoagulation, which generates more wrong answers than anything else here. And rehabilitation, quietly high yield and rarely studied. All of this lives in the neurology and cardiology sections of your review books. Search by topic name, not page number, because those change with every edition. Strategy 1. Every acute stroke stem hides a clock. Find it before you read a single answer choice. The stem will not say, hour 3. It says, last seen normal at 7, arrived at 9:30. Do the arithmetic yourself. Watch the wake-up stroke, where someone goes to bed fine and wakes with weakness. Last known well is bedtime, not wake-up time. That trap catches everyone. The second half is free points. Nothing happens before a head scan without contrast. Not the clot-busting medication, not aspirin. The scan answers one question, bleeding or clot, because the treatments are opposites. Any choice that gives a blood thinner before imaging is wrong. Cross it out on site. Strategy 2, and here, the outpatient mindset you built for the rest of Step 3 will hurt you. When the stem says the weakness completely resolved after 20 minutes, your brain relaxes. The test writer is counting on that. A transient ischemic attack is a warning shot, and the risk of a completed stroke is highest in the first hours and days after. So the choice that says reassure and follow up in a few weeks is a trap, and it appears on nearly every one of these. These patients need prompt evaluation, and therapy started now. Your rule: if the symptoms resolved, the question is about finding the cause and preventing the next one. Strategy 3 is the highest yield decision in this topic: antiplatelet or anticoagulation. Here is how to decide in 5 seconds. Ask one question: is a clot forming inside the heart? If the stem mentions an irregularly irregular pulse, or a heart rhythm problem on the tracing, or a mechanical valve, the answer lives in the anticoagulation family. If instead you are looking at cholesterol plaque narrowing an artery, smoking, diabetes, a narrowed neck vessel, then it is a platelet problem. Aspirin, plus a high-intensity cholesterol, lowering medication, plus risk factor control. And watch the overkill trap. The test offers full anticoagulation for a plaque-related stroke because it sounds more decisive. It is wrong, and it adds bleeding risk without benefit. Match the therapy to the mechanism. First question. A 70-year-old man with high blood pressure. His wife saw him normal at 8 at breakfast. At 8:40, sudden right arm weakness and slurred speech. He arrives at 9:15. Blood pressure, 170/90. Blood sugar normal. What is the next best step? Choice A, give aspirin by mouth immediately. Choice B, obtain a head scan without contrast. Choice C, give the clot-busting medication now. Choice D, lower the blood pressure urgently. Notice what the stem handed you. A witnessed onset, so the clock is clean, and a normal blood sugar, the test quietly ruling out the main mimic. The answer is B, obtain a head scan without contrast. Witnessed onset at 8:40, arrival at 9:15. 35 minutes, comfortably inside the window. And the normal blood sugar closed the door on the classic mimic, so everything points at the clot-busting medication, and that is exactly the trap. Inside the window means the medication is on the table. It does not mean you give it yet. A bleed and a clot look identical at the bedside, and the treatments are opposites. Now the eliminations. Choice C is the seductive answer, and most people who miss this pick it. It treats before imaging. Choice A fails the same test, and aspirin is not the acute move anyway. Choice D is a classic. That pressure feels high, and your instinct is to fix it. But in acute stroke, a higher pressure is deliberately tolerated, because it is perfusing brain tissue you can still save. The lesson, when the exciting answer looks obvious, check whether a required step comes first. Question 2. A 68-year-old woman in your clinic. Yesterday, sudden weakness of the left hand and drooping of the left face, lasting 25 minutes, then resolved completely. Today, she feels well, and her neurologic examination is normal. She has high blood pressure and high cholesterol. Her pulse is regular. What is the next best step? Choice A, Reassure her and follow up in 1 month. Choice B. Start full anticoagulation therapy. Choice C. Prompt evaluation including imaging of the neck vessels and heart rhythm monitoring. Choice D. A scan of the head with contrast in 3 weeks. Notice how comfortable this stem feels. That comfort is manufactured. The answer is C. Sudden focal deficit. Complete resolution under an hour. Normal examination now. That is a transient ischemic attack, and the resolution is not the happy ending. It is the warning shot. Now the eliminations, because this is where the teaching is. Choice A is the comfort trap. Everything here was engineered to make A feel right. She is, well, the exam is normal. She is in your clinic. And elsewhere on step 3, the outpatient answer usually wins. Not here. Delay is what harms her. Choice B is the overkill trap, and this is the fork we drilled. Look at what the stem gave you. Her pulse is regular. That is not filler. It is the test telling you there is no clot forming in the heart. Her risk factors are plaque disease. So anticoagulation is the wrong family, and just adds bleeding risk. Choice D fails twice. 3 weeks is far too late, and contrast does not answer this question. The lesson, when symptoms resolve, the question is about cause and prevention, not comfort. Question 3. The fork in the road. A 75-year-old woman, 4 days after a stroke leaving mild, left-sided weakness. Her scan confirmed a clot-related stroke, not a bleed. On examination, her pulse is irregular, and her tracing confirms an irregular rhythm nobody knew about. Her cholesterol is mildly elevated. What is the most appropriate therapy to prevent another stroke? Choice A, aspirin alone indefinitely. Choice B, anticoagulation therapy. Choice C, aspirin plus a second antiplatelet agent indefinitely. Choice D, no therapy. One phrase decides this whole question. Find it. The answer is B, anticoagulation therapy. The phrase that decided it was irregularly irregular. Those words are never decoration. They tell you the clot is forming inside the heart, not on a plaque in a vessel wall. Different mechanism, different drug family. The eliminations. Choice A is the trap for everyone who reached for aspirin on autopilot without asking where the clot came from. It undertreats a heart-related source. Choice C is the overkill trap in disguise. 2 antiplatelet agents sound stronger than 1, so it feels like the better answer, but you are still treating the wrong mechanism, now with extra bleeding risk. Aggressive and wrong is still wrong. Choice D ignores that the risk of a second event is highest right after the first. And notice the mildly elevated cholesterol. That is a deliberate distractor, planted to pull you toward the antiplatelet family. The rhythm outranks it every time. Question 4, and almost nobody studies this area, which makes it 3 points for you. A 62-year-old man admitted with a clot-related stroke, causing right-sided weakness and difficulty speaking. He is medically stable on hospital day 2. A nurse reports he coughs when sipping water. His family asks what happens next. What is the next best step? Choice A, begin a swallowing evaluation and start rehabilitation now. Choice B, wait until discharge, then refer to outpatient therapy. Choice C, strict bed rest until the weakness improves. Choice D, repeat brain imaging every day. That cough is not a throwaway detail. Nothing in a step 3 stem is. The answer is A. That cough when he sips water is the test handing you a swallowing problem, which carries real risk of food and liquid entering the lungs. It is a screening trigger, and it is why the question exists. Screen the swallow before you feed. The rule to carry, once the patient is medically stable, rehabilitation starts in the hospital, not after discharge. The eliminations. Choice B delays care that should start today, and delay is the recurring wrong answer across this whole topic. Choice C is not just wrong, it is harmful. Prolonged bed rest causes clots, deconditioning, and skin breakdown. If a choice says strict bed rest in a stable patient, it is almost always wrong. Choice D is our old friend, the overkill trap. Daily imaging in a stable patient changes no decision. It is expensive and useless, and this exam punishes exactly that. On step 3, doing more is not the same as doing better. Here is a filter you can run on any stroke question in 15 seconds before you read a single choice. 4 questions in order. 1. Bleed or clot, meaning has a scan been done. 2. What time is it from last known well? 3. Where is the clot coming from, the heart or a plaque? 4. Is the patient stable enough to start rehabilitation? Answer those and the right choice usually reveals itself. Then check the trap list, because the same three repeat endlessly: treating before imaging, reassurance and delay when symptoms resolved, and the aggressive overkill answer that sounds decisive but does not match the mechanism. Those three account for most of the wrong answers people pick. A word on where to learn this material, because this video is a strategy layer, not a content replacement. Work the neurology chapter of whichever major review book you use, and the cardiology section for the heart rhythm material. Look things up by topic name rather than page number, because editions change and page numbers go stale immediately. And here is the honest truth. The question bank is the teacher, not the video. Do these in timed blocks. Read every explanation, including the ones you got right, because getting it right for the wrong reason is a problem you want to catch now instead of on test day. Keep a running list of the traps that catch you. That list is worth more than any notes you will write. Let us bring it together. 4 rules that carry you through nearly every stroke question. Scan before you treat. Resolved symptoms mean urgency, not reassurance. Let the heart rhythm decide antiplatelet versus anticoagulation. And start rehabilitation as soon as the patient is stable. Master those 4, and the traps stop working on you. If this helped you get ready for test day, please give it a like and subscribe so you do not miss the rest of this series. And visit roadmaptoresidency.com, spelled ROADMAP, the number 2, residency.com, where our expert tutors and residency advisors can build you a personalized study plan. Thank you for studying with us, and we will see you in the next video.